the background of where you came from up to this lays the basis for you to be able to handle medical marijuana. Because a lot of people hear marijuana and or the doctors is putting people on drugs, you know, or he's part of something, or it's got such a bad connotation, and yet it is a fantastic drug. I learned and realized the value of it. But what was your motive for you to be, you know, take your medical practice and deal with medical marijuana? We're talking about the patients now.
Yeah, sure, absolutely. Well, I'll give you some more background that a lot of people don't know about me. Well, I'm lifetime drug-free. I'm Irish and Italian. I don't drink beer, and I don't drink wine. You figure, Irish and Italian, he drinks beer and wine.
Right, exactly.
I just never was, you know, I never acquired a taste for alcohol. I'm not saying I never had a drink. I don't. That's just not my thing. I like Coke Classic. I drink Coke Classic. That's my vice.
Right.
Never did drugs. I'm lifetime drug free. I've never
Maybe
smoked.
that's the reason why they call you a minister of medicine.
well, when I spoke to my friends that I grew up with, and then when I said I'm going to start prescribing medical marijuana, they all laughed because they know my background of being lifetime drug free, and so they like really said yes. I said. About 5.5 years ago, a colleague of mine introduced me to medical marijuana, and he said, New York State's going to pass this, and this aligns with the way you practice medicine. I take a holistic approach. I have a master's in clinical nutrition, so I do not prescribe medications. If I can treat, I mean, I do prescribe meds, so let me rephrase that.
Right.
But my first line of treatment, if I can treat naturally, let's say, for example, someone comes with high cholesterol. If their cholesterol is just over what we call high normal, and it's starting into the cutoff is 200. Let's say to 225, 230. I would say, well, let's try diet modification and behavioral change. Let's go on an exercise program. Let's repeat this in 3 months. I'm not going to give them medication first time out. I want to see if I can change their behavior and naturally treat them. So this is medical marijuana. It's natural, and I don't use, I don't say drug. What I do is I say a natural medication, or I will say, and I prefer natural supplement. Okay, and when I say that to the patients, they really latch on to that. Most of my patients, the majority of my patients now are coming in, they have chronic conditions and specifically chronic pain, and they were initially put on narcotics, opioids. And the first thing they say is, I want to get off this. And I said, I know. I said, it's changing your behavior. I said, your personality's changed. And I said, yeah, how do you know? Well, because the opioids change the biochemistry in your brain, so you start to behave differently. You start to hear things and respond differently when you're having a conversation with your significant other. And here's an example. A lot of times partners would come in, and I'd say, you have a normal conversation? And I go, yeah. I said, you might say, hello, how was your day? And the other person will interpret that, well, what do you mean? How was my day? I didn't do anything? Because they start to interpret things differently. And it's like, no, I just asked, how are you? So the brain chemistry changes. And so their response is different. And I say, just give me a few weeks. I'll have you off this, maybe a month or so, depending on how long they've been on the medication and the dosage. But as soon as I get them off, the relationship increases, it improves, and everything's back to normal again. Their personality changes to who they fell in love with. It's really great. I've had phenomenal results.
Well, I'll tell you, you've been my doctor for 20 years, all right? And I've been medication free. People can't believe it, that you're not on any kind of medication. I said, no, but I was taught by my doctor 20 years ago that I don't have to. All I have to do is make the necessary adjustments. I remember the first day, you did my blood work, and you sat down there and you explained every area, and at no time did you write a prescription. No. You said, just make a little change here, make a little change here, cholesterol up, make a little change here. This is 20 years and no medication, nothing for sugar or diabetes or anything like that.